Hi, my name is Sophia Medina. This is my psychology and film assignment. I decided to pick the character Katniss Everdeen from the movie The Hunger Games. The Hunger Games is set 300 years in the future in a dystopian society set in the nation of Panem, that is a wealthy capital surrounded by 12 poor districts. Katniss comes from District 12. There used to be 13 districts, one rebelled, and due to that, there was a punishment, which is the Hunger Games, where one male, one female is selected from each district to fight, usually ages 12 to 18, and it's broadcasted on national television. This culture shows the dramatics between a very poor society and a rich society, the socioeconomic differences between the districts and the capitals. Katniss Everdeen takes the place of her sister Primrose during the reaping of the Hunger Games. Complex post-traumatic stress disorder. PTSD is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, series of events, or set of circumstances. Complex post-traumatic stress disorder is where someone cannot heal from the trauma because they keep experiencing it day after day, year after year, month after month, whereas post-traumatic stress disorder, it's one event and they're healing from that one event. I do not believe Katniss would ever seek therapy for the Hunger Games due to socioeconomic factors. However, if she did, the therapist would most likely diagnose her with nothing, as CPTSD from the Hunger Games would be a normal occurrence, as there have been many games she would most likely would seek counsel from Haymitch. Her games mentor who has competed before her. This illness is not diagnosed in all cultures, as some may see it as another disorder such as anxiety. Some stigma around CPTSD is that you have to be characterized as a war victim to be diagnosed with CPTSD. This leads to the feeling that they have to be crazy or dangerous or violent, and so oftentimes their diagnosis will go undiagnosed. Let's watch a small clip. In this scene, Katniss Everdeen wakes up from a nightmare she has from the Hunger Games. This is a common symptom of PTSD. It's listed in Criterion B in the DSM-5. The traumatic event is persistent re-experience in the following ways: unwanted/upsetting memories and nightmares. This scene accurately depicts this symptom, which is a reason to diagnose Katniss with PTSD. Let's watch the second clip. Get out! Prim is gone! Prim is gone! In this scene, Katniss Everdeen's sister, someone who is very close to her, has just passed away. This scene shows another symptom of PTSD, that irritability and anger. Criterion E in the DSM-5 highlights trauma-related arousal and reactivity that began or worsened after trauma. Like the previous one, the scene accurately portrays the symptom Katniss exhibits, which falls into the category of CPTSD. This is going to be a weak symptom, which is going to be avoidance behavior.
Someday I'll explain it to you. Why they came. Why they won't ever go away. I'll tell you how I survived it. I make the list in my head.
Media does not accurately always portray mental illnesses in great depth and detail. In this scene, Katniss is portraying another symptom found in the DSM-5, avoidant behavior. Katniss uses self-soothing techniques, which she describes in her head, to get over the nightmares and experiences, as she does not like to talk about the trauma she went through. The consequences of this action are further discussed in an empirical essay, which shows that an over-reliance on avoiding coping strategies may interfere with the natural recovery process. Plan of treatment. If I were a licensed therapist and could diagnose and treat Katniss Everdeen, I would inform her of the diagnosis and treat her accordingly. My treatment plan for Katniss would consist of a holistic approach with cognitive processing therapy to help with her emotions, and as well as slowly prolonged exposure therapy to help with avoidance and lack of discussion she experiences. The effectiveness of these holistic approaches is seen to be very helpful and very common in today's society, with over 74% of patients losing their diagnosis within 2 years. These treatments are appropriate for the disorder, as they're mentioned in the DSM-5, as well as it is appropriate as there is not really a medication to give to patients experiencing PTSD. You can only treat the symptoms that may come, like depression and anxiety. The concerns for this treatment plan are quite low. The only concern would be introducing exposure therapy slowly, as to not bring up any dangerous emotions toward the CPTSD she went through. Within the setting of this movie, money, lack of resources, and privacy come into play, with no actual therapist offered by the capital, no natural way of controlled exposure therapy, and a lack of money. Katniss' treatment plan will look highly different from someone suffering from CPTSD in our current society. As mentioned before, she'd probably go and seek counsel from Haymitch, who also struggles with PTSD. I think the disorder of CPTSD is portrayed reasonably well in The Hunger Games. While considering that this movie's primary focus is not on the disorder of CPTSD, the directors included many scenes that accurately supported the inference of the illnesses in Katniss' life. The movie references many symptoms that come from CPTSD, which are shown in the criterion section within the DSM-5. I'm someone who personally has been diagnosed with PTSD in their life, and I appreciate the director's accurate depiction of PTSD within The Hunger Games. I believe that accurate media depictions of these illnesses can help destigmatize these disorders and ultimately allow the world to understand better what it's like to live daily life with mental disorders. It also encourages people to learn more about the illnesses and shows that the disorders are not abnormal and that everyday people suffer with these disorders. Here are my citations and references, and I hope you enjoyed.